Welcome to another WPS Government Health Administrator Provider Outreach and Education YouTube video. My name is Rachel Wood, and I'm one of the nurse analysts with the Provider Outreach and Education team. Recently, WPS announced that our medical review nurses will be reviewing lipid testing as part of the Targeted Probe and Educate, or TPE, program. Reviews will include providers in J8 Part A and J5 Part B. This video will review coverage indications for lipid testing, where to find the Medicare guidelines, and documentation tips for a successful review. Let's get started. Where to find lipid panel coverage criteria. WPS follows Medicare guidelines for lipid testing for Medicare beneficiaries in the CMS Internet-Only Manual 100-03, Medicare National Coverage Determination, or NCD, Chapter 1, Part 3, Section 190.23, lipid testing. So let's take a look at coverage indications and what clinical situations may be covered for lipid testing. A lipid panel is a common blood test used to monitor and screen for risks of cardiovascular disease. The lipid panel includes measurements of cholesterol levels, including a total cholesterol, high-density lipoprotein, or HDL, cholesterol, and low-density lipoprotein, LDL, cholesterol, as well as a measurement of triglycerides. Per guidelines outlined in the NCD, the medical community recognizes lipid testing as appropriate for evaluating atherosclerotic cardiovascular disease. Conditions in which lipid testing may be indicated include assessment of patients with atherosclerotic cardiovascular disease, evaluation of primary dyslipidemia. This includes patients that display signs or symptoms of this diagnosis, such as skin lesions. Any form of disease which arterial plaque builds up, or any disease leading to the formation of arterial plaque buildup, diagnostic evaluation of diseases associated with altered lipid metabolism. This could include, but is not limited to, issues such as nephrotic syndrome, pancreatitis, hepatic disease, and hyper and hypothyroidism. Lipid testing may also be indicated for secondary dyslipidemia. This could include dyslipidemia that relates to the diagnosis of diabetes, disorders of gastrointestinal absorption, or chronic renal failure. Finally, to monitor the progress of patients that are on anti-lipid dietary or medication management for the treatment of elevated blood lipid disorders. Now, how frequent does Medicare cover lipid panel testing? So this will vary based on why the patient requires the lipid panel. Any one component of the panel or measured LDL may be reasonable and necessary up to 6 times the first year for monitoring dietary or medication therapy. More frequent total cholesterol, HDL cholesterol, LDL cholesterol, and triglyceride testing may be indicated for marked elevations or for changes to anti-lipid therapy due to an adequate initial patient response to either dietary or medication therapy. Providers may measure LDL cholesterol or total cholesterol 3 times yearly after treatment goals have been achieved. Medicare does have coverage limitations for lipid testing that includes the following. For lipid panel and hepatic panel testing, providers may use these tests for patients that develop hyperlipidemia with severe psoriasis. Medicare does not cover routine screening or prophylactic testing for lipid disorders. Less specific diagnoses, for example, chest pain, alone does not support the medical necessity of lipid tests. So, what should providers include in the documentation for a successful TPE review? Include the following information: signed provider order, progress notes to support a covered condition, current patient medication list, lab test results, both past and present, and, if it applies to the patient, a copy of the Advanced Beneficiary Notice of Non-Coverage, or ABN form. Do you have more questions regarding lipid testing? Email us at wps.gha.education@wpsic.com. If you found this video helpful, please like, comment, and share it. Subscribe to our YouTube channel for more WPS provider outreach and education and Medicare updates. Thanks for watching.